Hey, what's up, everyone? Welcome to another episode of the Dental Assistant Nerds podcast. I'm your host, John, and today we have a very special guest. But right before we get into that, this episode is actually sponsored by Joia Scrubs, Joiia, and I'll drop the link in the description of the episode so you can save 15% on your Joia Scrubs. But first, let me get into my guest for today, Jean Carter. She's currently a practice manager from Tennessee, and she originally got into this amazing field as a dental assistant. So I brought her on today to talk about all the things that she has experienced, and of course, what it is that she can share with us as far as what can dental assisting do for you and what can you do for dental assisting. Jean Carter, thank you so much for joining us today.
Yeah, definitely. Anytime. This is my favorite topic.
It's your favorite topic? Well, listen, I talk dentistry so much that
Mhm. Mhm.
sometimes I'm like, something's got to be wrong with me, but I love it. I love
I
all
know.
things dentistry, right? That
You have to love it. You really do for it to love you back. I have been in it for 20 years. I'm still a registered dental assistant, even though I have different titles now. I have a huge respect to dental assisting. It has always fed me, provided for my family, and just seen me through so many different adventures in my life. I am a true dental gypsy. I started in Philadelphia, Pennsylvania, and then moved across the East Coast and went to Texas even, and now I'm in Tennessee. And the one thing that was constant in that was dentistry.
dentistry is one of those things when people ask me about, why dentistry? I feel like dentistry, it's recession proof.
Yes.
It's a very safe field. When I got into dentistry, basically I tested well on my ASVABs and I went and talked to the
Right.
recruiter and I was like, I need something that I can do, not necessarily thinking forever, but I needed to get out of the military and be able to do something right away because I had friends that were, like military aircraft mechanics, or
Yeah.
of course, like they guarded nuclear silos. And it was like, what are you going to do civilian wise, right?
Right. It's a
So,
huge change.
so I remember talking to the recruiter, and it was like, well, dentistry is one of those things like people always need.
Always.
Being 17-year-old kid, I was like, I can't believe I thought like that, but it's 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 a very safe field and
That's
safe in a sense of like look at someone like yourself who has managed to move to a new city and bam,
mhm.
bam, like right away, like you're in a practice, right? So
Immediately.
yeah.
Actually, immediately. It carries you. I remember even just my final move coming from Texas to Tennessee. I was hired before I moved in the state. I had my LinkedIn fired up. I just mass friend requested every local general dentist specialist because of course I can go into any part of dentistry. I've learned all of the specialties, and I was able to land a position before I even moved my belongings here.
Wow. Yeah,
So that's how much, dentistry can carry you. And that's coming from a person that, in the beginning, I was like, I don't know what I want to be when I grow up. I have no idea. I was just this person kind of doing these side gig jobs, and they paid, but I just didn't have any type of routine. It was just kind of gigging and picking up things. And then I was like, you know what? I want to go to an office. I want to have a home that I go to daily because you spend more time, at your 9 to 5, more than home sometimes. So I wanted that consistency. And, even if you're in the dental field and you're like, what is she talking about consistent? Every day is like spaghetti and throwing it on the wall and seeing what sticks. There's still the bone structure of you going to that same place every day, setting up for the procedure of the doctor, seeing patients, having a good time, having a not so good time. It just depends on the shade of the day. But at the end of the day, you're still having that same place to go to, and it's consistent.
yeah, and dentistry is very repetitive. That's something
Very.
constantly preach to our students, to new dental assistants, that
For sure.
one of those things that the sooner you learn the basics and you get it down,
Yeah,
obviously materials and the way that different dentists do things
for
might
sure.
change, but the basis of the procedure is very repetitive.
Yeah.
So, putting in that work and
Hmm.
learning as much as you can, as fast as you can, it just leads to a lot of great things. That's what Gene and I were talking about earlier, is
For
just
sure.
the opportunities that can present themselves.
So many.
Yeah. I mean,
It
look,
leads
look
me.
right, look at Jean. She's an inspiration to us as far as
Yeah.
practice manager. So how did this all happen? So 20 years ago, you 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 were telling me you did. I don't want to
I
date it.
will
I don't want
be.
to date it. What did you do to find that office?
Oh God, you're throwing me under. Well, yeah. So 20 years ago, Jean was, cleaning homes and again, the side gig jobs. And I remember in my 1988 Camaro, I had a vacuum cleaner, buckets, all the cleaning supplies, and I was fighting with it in the rain. And I was just like, I need something different. That's it. Like I thought I can be outdoors all the time. Outdoors, Gene. I love the outdoors. I just don't like doing work outdoors, I found out. So I wanted to be, something different. So I went and I purchased a newspaper. So some of you may know what that is, and some of you don't. But there was what's called a classified section where they listed all the jobs that were available. So it's kind of like, current day online for Indeed. Um, and I seen, all the things that were in there, which were telemarketing and, cubicle, jobs. No, no, thank you. And then I saw a dental assistant and I was like, teeth? Let's see what happens. And it did say, we'll train the right candidate. And I was like, I could do that.
I'm that candidate.
Little did I know there was some learning curves. But I did get to, work along a ton of doctors, in that time, in that period. I mean, like, you and I spoke about, you got to put in a good 5 years to really find out, and figure out dentistry because it does there's a lot of curveballs. But once you, get the bases down and work with different providers and spread your wings, you're unstoppable. That's the one thing that I can take away because I started off with a small, mom and pop practice. And then I kept going from there and build looking at bigger practices, group practices, university structures. That's where I was like, give me more, give me more. I want to know all about dentistry. And I'll be very honest. Here I am as a practice manager and a chapter president doing mainly majority administrative work. I said back then, you will never see me pencil pushing because I loved dental assisting that much.
Right,
I
right.
loved patient care. I still love patient care. Even though I don't practice on patients anymore as much as I used to, I still saw a patient the other day just because I could. And I was helping that child out because we were going into the weekend and they were in braces and I wanted to be able to make them comfortable for the weekend. That's still there. That patient care will never leave me because it's just what has I have a big respect for it, and that's what has helped me through my years.
Yeah, and it sounds like that's what has driven you to this point.
Huge,
And you
huge
know,
drive.
I think, office managers, practice managers, when they started at the ground floor, right?
Yes.
And they took all that in. That was
Yes.
probably the one of the hardest parts when I went to a DSO and, somebody coming from a Dunkin' Donuts or from a Victoria's Secret is telling me,
Yeah,
because they had sales experience. So they're
for
telling
sure.
me, how to work and operate. And it was very hard pill to swallow,
Hmm.
trying to decipher and get on the same page, right? But
Very much.
but whenever, someone like yourself, you've been there and you're trying to talk to the assistants and the clinical staff, and it's like you've been round and round throughout the
Yes.
day. You understand the ups and downs, and that's something
Wholeheartedly.
that's something you and I were talking about earlier about the days in dentistry. Even though they're repetitive, they're different, right?
Very.
And as we know, the more and more I talk to dentists, they're like, I just want somebody with a great attitude, right? A
Absolutely.
great attitude. They're kind of willing to look that it might take someone a minute to learn something,
That's
as long
okay.
as they have a great attitude. But if you
Right.
have a bad attitude
For sure.
and you also have an unwillingness to learn, that's
Mhm.
just a recipe for disaster. And as we were talking about, when we see things in these groups all the time, it's just assistants are very negative. They're complaining about, their current situation.
Yeah.
And this is why I was excited when you agreed to come on because you're someone who has risen above that. It's like you have taken opportunity after opportunity. And
Yeah.
what you said earlier, it's a great example of you started looking and seeing bigger things. When
Absolutely.
when you're an assistant and if you're perfectly satisfied with just sitting in a chair and sucking spit, that's all you do, right?
Right.
And
Right.
unfortunately, that's why some of us get labeled that way because of
Hmm.
that person who's not willing to go the extra mile and learn things. And early on in my career, um, I definitely didn't take advantage of, hey, we want to show you how to do this, show you how to do that. I was like, no, I'm good. I'm good. Now I'm at the point in my career where it's like, I was like, I think back all the time. There was a doctor who wanted to show me denture steps. Obviously, out of my scope, but
Right.
at the time, I was like, man, that would have been really. Now that I'm teaching, I feel like technically I could explain it better than just what I do.
Right.
And what are they actually looking for whenever they're putting together the bite from the bite blocks, and I don't know. So
Right.
I think that the more you can learn, it does make you more of an asset. Some people obviously are just kind of like, well, they're not going to pay me anymore. Maybe that particular office won't, but
That's it.
that's the key is finding the alignment of everything that you're looking for in an office, but also
Mhm.
an office that appreciates what you're bringing to the table, right? I
Absolutely.
think I get it. Like maybe Dr. Smith's office, they're not interested in what you're trying to, bring to the table as far as digital scanning or milling or whatever else it is that when you see those bigger and better opportunities,
Mhm.
that's unfortunately why you want to leave. I mean, I left a small practice for a DSO because,
Mhm.
I remember trying to talk to the doctor about rotary files and he still did everything by hand and he's like as for people who don't know how to do root canals. That's what he told me, because I started temping on off days and I would see all these things and I'm like, listen, you got to get your hands on one of these rotary hand pieces.
Yeah.
This was way back. I mean, I stopped working at an office in '07, so this is probably right around the time that walked in, and started taking your exams. But
Right.
um,
Right.
you know, sometimes I think we become also a product of our dentist because that dentist wasn't interested in evolving. I remember he would take me to CE events, and it was like we wouldn't go for real dental CE events. It was like minor composite restorations. I remember one was like a lot of health and like heart, because they just have to take CE.
They have to get through what they're mandated to get.
Yeah, so it wasn't like we were going and learning like new techniques and so I was grateful he took me to CE, but it was kind of
Absolutely.
like, it wasn't like beneficial to I didn't come back the next day all pumped up like, yeah, let's treatment plan this 6 unit bridge because of everything we learned, And
Right.
and honestly, eventually he sold the practice and I was devastated at the time because I was literally like out of a job, but it opened up all these other doors where who knows, I might have stayed there and just wasted away. It's kind of like
Very true.
now, I got job offers, but I immediately was like you, like I was hungry, I was thirsty,
Hungry.
and I immediately got introduced to digital X-ray and
Yes.
from there it's just like the ladder just kept, I think the same way. It's like, you
Mhm.
know, you have to want more to to get to a different place. One of
Right.
one of my favorite quotes is, you can't expect the end of the book to be different if every chapter is the same.
That's exactly right.
So, if you're just going to work, this office isn't doing anything, they don't want to listen to new ideas. And I get it. Like, it's their business, right? Like, it's
That's
their
exactly.
office, it's their baby,
But
but
it's not yours.
it's not yours, and you don't have to be confined to it. And,
That's exactly
honestly,
right. We have a choice.
when you get out there and you look on these websites and you're like, hey, maybe you want to do implants, maybe you want to do perio. When I got exposed to
Absolutely.
perio, I was like, my mind was blown. Like,
It's
honestly,
different. It's a different beast.
and because I worked at the VA for a few years and we did every specialty but ortho, and I just always thought perio was like, oh, maintenance and root planning, and it's like working. We're doing sinus bumps and lifts and
Yes.
implants and these grafts. I mean, they were doing crazy stuff with the sutures, and I was just like year one John again. I was just like drawn in. I was like, I love this.
Uh-huh.
Yeah. So something that you might think, well, I'm never gonna be a fan of. I mean, look at how many people love endo. Like, I can't imagine sitting there doing 6 to 8 endos a day, but they love it. They're definitely a different breed to just sit there and want to do endo all day and pass files. Um,
Right.
I mean, it takes all kinds, but you do have to wonder, okay, like what kind of an advancement is it to be an endo assistant?
Right.
Right? It's like certain things, like if you're truly hungry and you want to do like great things. Now, I do know some endodontists who really take great care of their staff. So
Absolutely.
I get it. I mean, yeah, I mean, you know, some of these specialties, it's like they're taking staff on cruises, and I'm just like, I want that. I've never never been on
That,
a cruise.
that's the office I'm actually working in now.
Okay. Yeah.
We
Yeah.
do go cruises, and it's an amazing thing, but hey, but not everybody likes a cruise.
Yeah. Well, just to be appreciated and
It's
receive an
huge.
offer. Listen, and I'm not going to put down a pizza party because I love pizza, so
See, I love a pizza party, but the stigma is there. So
yeah.
yeah,
But that still
I'll never
doesn't
serve
stop
it.
me. Like, if they're like, "Hey, we're getting pizza," I might like complain under my breath. I'm not going to complain openly, but as long as they can make like a pepperoni sausage happen, I am good to go. You're not going to hear
In
me
there.
complain.
Yeah,
It's like, "Hey, we're
absolutely.
going to order pizza," and everyone's like, I can't believe this," and I'm over there like.
Tearing it up. I'm ready.
Yeah. Yeah, we ordered pizza the other day at school, and my one student was like, I don't like pizza. And I was like, what?
I know.
And they were like, well, I used to eat pizza all the time. I said, listen, I have pizza 3, 4 times a week. Like, this is not stopping this train.
No,
It's I
no,
go into an office and pizza, it, I don't mind. I'm one of these people, like when I go on an interview, I want to know what time is lunch, because I cannot work 8 hours straight without something. I just need 10 or 15 minutes to
that's right.
put some food down my throat. And if it just so
Right,
happens that you're like, hey, we're working straight through and I ordered a pizza, okay, I'm back on board. I am
right.
back.
I know. And there has been many times, I mean, now I hardly take a lunch, but many times in my dental assistant career where I could not take a lunch. You have that patient that's going over and we're doing, a CEREC crown for and we're going through lunch. I've had employers that pay for a lunch and they get me that lunch and I have a minute to eat while it's milling.
Yeah.
Um, or I have something in the fridge laying around and I shove it down and I'm right back in the clinic. So it's not always that lunch there as much as I'd love it. But again, it's the bigger picture. We're there for the patients, and that's another thing that kind of goes unnoticed because they're just, I mean, people can get used to just, it's a job, I need a lunch and all the things, but you're really there for patient care and they are the most priority in all of it. And if it's somebody in pain, absolutely. What would you feel? Yeah, I always have to put that shoe on.
Yeah.
What does that patient feel? They are desperate. They want relief and if it just takes a little bit of our time to kind of help that, I mean, that's the gratification of its own.
Yeah, I think, you're absolutely right that we become complacent and
For
that
sure.
we get used to a lunch or we get used to walking out the door on time.
Uh,
And, if
yeah.
that patient does come in and, something can be done, then, it's kind of like, I think most offices fail in the communication department, right? It's
Oh, all
like,
the time.
it's
Yeah.
kind of like they don't have a plan for emergencies at the end of the day. And a lot of times, if if somebody would just kind of take care of it instead of everybody arguing, that just adds to the amount of time. I
Right.
couldn't tell you how many times I was in an office and, a chart would go up 20 minutes before lunch and they would avoid it. They want to. It's like, meanwhile, if you'd have just brought that patient back, grabbed an X-ray instead of
Get
waiting
it.
for someone else,
Yeah.
we could have walked in there, given a script, maybe rescheduled them for after lunch. But now,
Triage it.
now
Absolutely.
it's like 15 minutes into lunch, and we're just now seeing this patient. So it's
Right.
like a
Don't
lot
get
of
in your own
times,
way. Don't get in your own way.
yeah, a lot of times, just when I go back to attitude, it's like
Oh, yeah.
yeah, like not just not just you betcha, and I smile in a great attitude, but then also just the attitude of taking charge and, hey doc, you want me to bring this patient back? Do you want me to just get an X-ray, put him back out front? We can eat real quick. Like
Absolutely.
you gotta
Manage it.
talk. And
Yeah,
you know,
manage that patient, manage that schedule, manage your schedule, take throttle of it. And sometimes your
yeah,
doctors want you to do that. They're just like, whatever, I'm here, it is what it is. You have to think they're practice owners.
yeah.
Their minds are going in so many different directions, and they're probably not even when they give you a short answer, don't take it offensively. They're probably thinking of the bill they forgot to pay.
Well, and that's a great point because that's something I always preach is that dentists are people too, right?
They have feelings.
And well, not even feelings, but they're also their mind's racing other ways.
Oh, for sure.
So I think I've been in practices before where I've been, part of 3 and 4 assistant teams. And,
Yes.
you know, one thing is like, let's say you're scheduled for an hour lunch. If you're working into that lunch, someone needs to take charge, communicate, hey, I'm going to stay and start working on this patient. Can you come back 15, 20 minutes early,
Absolutely.
relieve me so that 3 people didn't get an hour and one person got zero? It's kind of like, hey,
Stagger lunch.
hey,
Stagger.
we're a team. Everybody's always like, oh, I'm a team player. I'm a team player. That's what they say in the interview, right? And it's like,
Hmm.
and if it's one thing in dentistry that gets overlooked is a lot of times the dentist is okay for a couple minutes. I mean, I've worked with some dentists who are like, I need someone in here to, handle this live ejector while I'm
Yes.
giving an injection. But for the most part, they can handle like 5 or 10 minutes, by themselves. I'm gonna go take this X-ray. Hey, are you okay for a minute? You know, like just communicating that, hey, I see you're getting ready to pack cord. This is probably a good time for me to step out of the room and get that X-ray. You
Yeah.
know, but just not saying anything. They're not thinking like that. They're not thinking along those terms of, all the other patients. One of one thing I once read online, I'm not going to be like, oh, one of my favorite quotes. One of the things I read online was, the perfect dental assistant is essentially like a computer with the browser with all the tabs open.
Yeah.
It's like you're just constantly thinking about everything that's happening.
The
Um,
big picture.
yeah, the big picture, right? You're ahead. They always talk about in
Have
a
to be.
procedure being a couple of steps ahead, but the a really great dental assistant is processing everything that needs to be done. Hey, I took some impressions earlier. I got to get back there, pour those up.
Yep.
That case has to
Mhm.
get sent to the lab. You know, and I always tell when I work with someone, I always tell them if you need something, tell me. I'm not going to take offense to it. Of course, I'll say please and thank you, but don't take it as I'm bossing you around, you bossing me around. Like we have to talk to get through the day. Hey, can you go
Yes.
ahead and seat that
Ah,
patient in room one? Yeah, not a problem. I'll go ahead and do these instruments.
that's
Like,
right.
I think some of my best teammates were people who didn't take offense. It was the people that all of a sudden were offended because I asked them to do something that
Yeah.
they were kind of like, well, that's not my job. That's not my job. Like, we're
Worst sentence to hear.
yeah,
Worst
we're
sentence.
yeah, we're trying to be a cohesive unit here. And
That's right.
I'm sure that that's what you're preaching, and all your years that you've been on that ground floor and made your way to the penthouse. I'm sure that those are some of the things that you're preaching, and
Mhm.
that's what that's what really makes a successful and a great office. I just talked to a doctor right before this call, and he was like, "Hey, this is Doctor, super nice guy." And I was like, "Wow." I said, he's like, "How are you doing?" I said, "I'm better now," because normally I'm on the phone getting yelled at by people.
Huh?
Uh, I said, "Man, I called. Your front desk sounds amazing. I asked for your hygienist and they told me she was taking out the trash." I was like, "What is your secret? You sound like a good person." And he's like, "Honestly," he said, "I'm just, I try and treat people with respect and hold everyone accountable." And I said, "Well, whatever you're doing, man, you're doing great things." And I talked him through a troubleshoot on an X-ray, and he was like,
Yeah.
"Hey, thanks so much." And I said, "Hey, thank you." Like anytime the phone rings, sometimes I'm like, "Oh boy, what's it gonna be today?" Um, but overall, just talking to everyone in this field, it's been a pleasure. I'm so glad we were able to finally work it out. I know we've been talking about this for a few weeks, and
Definitely.
we've been social media friends for years
Yeah.
now.
Oh, yeah.
So we got to talk about our adventures and our journey,
For
and
sure.
we were like, hey, this is finally like one of those times. Like we've talked before, but
Hmm.
face to face, and
Yeah,
I'm sure eventually we'll get to meet in person and talk some more.
I'm sure.
So, but thank you so much for joining us today. Did you have anything else you wanted to add to the listeners?
I
Any
always
words of
say,
wisdom?
yeah, no, I always say, you have my name. If you find me on Facebook, I'm sure John's going to tag me in this. And any questions from, you know, just from your perspective, listener wise, reach out to me directly. I'm in real time, I'm multi-state. So I've already worked through all of these things, different teams, different dynamics. Like I can really speak on a lot actually in my career. Um, to just help and be a support because the biggest thing you need in this industry is a great mentor. um, Not every doctor is a mentor, and that's not, saying anything bad about, some providers, but I was also told a lot of my career that dental assistants don't belong being managers. And I'm told I am a good manager because I'm a dental assistant. So that's the biggest takeaway from this. And it may feel like the bottom of the barrel right now as you're beginning, but it can be very fruitful. And I want to be able to pave that path for you. So I am easily accessible on Facebook, Instagram, everything. Just to kind of give you that real life, like, hey, keep at this, and I'll give you different resources as well. And John, you're amazing at it as well. So
Well, thank you. I appreciate that shout out. Well, what you just touched on, you said a lot of great words of wisdom today, and I love it. I can't thank you enough for that.
Thank
But,
you.
you were told one thing and then somebody else cherishes you, right? I think,
Exactly right.
as we know, one man's trash is another man's treasure. And,
Correct.
basically, when a dentist puts their team together, they value different things,
Absolutely.
plain and simple. And so, when I tell students or other assistants, when you go on an interview, sometimes it's kind of out of your control. Don't be like too beat up.
Hmm.
You just have to go and be you and say the things. And, at the end of the day, you really don't know what it is that they're really, all the factors that they're putting into this decision making.
That's exactly right.
When I worked for DSO, I would have amazing people come in, do the interview, and then right away the manager would be like, well, we can't hire them, they're out of our price range. And I'm like, well, you saw the resume, certainly you knew what the price range was.
That's
It's
exactly
like,
right.
why did you even have me waste the time and interview these people? So, if you're, in your journey, no matter where you're at and you're feeling a little bit discouraged, there truly is an office for you. Somebody
Yeah,
is going to see what you bring to the table. I've been in
absolutely.
offices where assistants make more than front desk. I've been in offices where front
Hmm.
desk makes more than assistants.
That's exactly right.
And some dentists are like, well, my assistant's always going to make more because they're in danger. They're my right hand person. And then
Yeah.
other doctors are like, well, my front desk handles the money. That's why they get paid
Business.
more. And
That's
it's like,
exactly.
well, I'm like, well, what is the logic in that? Because, my grocery store, the cashier doesn't make more than the person, the person back there cutting the meat. Like,
Right. And
so
they're
it,
handling money.
yeah. Yeah, so once again, it's just like based on what it is that they value and how they set it up. So don't be discouraged. And
No,
Jean Carter here, she's been a great resource and she has definitely offered, hey, you need some help, feel
absolutely.
free to reach out to her. Of course, you can always reach out to us.
Yes,
So that's going to put a wrap on this episode. This is something that, Jean and I are like, hey, we can talk all the time. So maybe we'll schedule another episode in
absolutely.
future. We
Yes,
can kick around some other stuff to talk about. But,
for sure.
certainly thank you so much for joining us today on the Dental Assistant Nerds podcast. If you have a topic you'd like to discuss or even follow up with today, feel free to email us at cornerstonedainstructors@gmail.com. And of course, we appreciate the support. So thanks so much for following, liking, subscribing to us on TikTok, Facebook, Instagram, YouTube. We appreciate wherever you're finding us. And of course, you can find the Dental Assistant Nerds podcast on Spotify and YouTube. So once again, thank you so much, Gene Carter, for joining us.
Thank you for having me.
Thank you, thank you. And we look forward to catching you on the next episode of the Dental Assistant Nerds podcast.
Sounds terrific.